welcome back. So how are you feeling?
A little bit excited actually.
Alright,
Yeah.
so we have just gotten your report back. Let me just go through with you for the report. I have checked this hematological screening. So all your blood count seems normal to me. And also your sugar control is very good, where your fasting blood glucose and also your HbA1c, which for the 3 months control is excellent. So you are non-diabetic. Both for your kidney and also your liver and your tumor markers, everything is good. So do you know what is your lipid profile? Do you know what is that?
I don't know.
Okay, so basically lipid profile consisted of total cholesterol, triglyceride, which is the fat, HDL cholesterol, and also LDL cholesterol. So your total cholesterol is slightly highish, where it exceeds the normal reading.
Oh really? That is actually quite surprising. I've always been maintaining a very healthy diet.
High cholesterol, or we call it hypercholesterolemia, can be due to many factors. So generally, we can classify it into two, which is primary and secondary. So primary factor includes genetic predisposition, or what we call it family history, or secondary factors which include lifestyle, also metabolic diseases, kidney, liver, and maybe due to medication.
Oh doctor, I suddenly remember. I had a very late supper the night before the blood test. Will it affect my blood test result?
It's not true. The most recent studies show that a fasting and a non-fasting lipid result, there is not much difference. So even if you are not fasted, your cholesterol level in the blood test will be very accurate.
Oh doctor, so does this mean that a slim person would generally have a low cholesterol level?
That's a general misconception that people who are slim, their cholesterol level will be low. Like I said, cholesterol can be due to many factors. However, weight does correlate to the cholesterol level, because when you are obese, of course the risk factor for cholesterol will significantly increase.
Oh yeah doctor, what is the difference between a good cholesterol and bad cholesterol?
A very good question. So basically, cholesterol is a term collective of all the lipids in our body. So there are two types of cholesterol, namely HDL and LDL. So how do we remember that? So very easy. HDL means that high density lipids, which mean good, and LDL means that low density lipids, which is bad cholesterol. So just remember, high equal to good and low equal to bad. So what are the examples of HDL and LDL source of food? For example, you can increase your HDL level by taking avocado, omega-3 fish oil, and also for example walnut. And LDL food sources are abundant. For example, fast food, processed food, and fried food.
Oh yeah doctor, I remember cholesterol medication would be a lifelong commitment. Is it true?
A lot of people thought that once they are started on cholesterol medication or hypertension medication, they will need to be continuously taking the medication. However, that's a misconception. Basically, when a medication is started, the aim is to achieve a good control and also to prevent the complication. So for example, if a patient through medication had already attained a good control on the cholesterol level and the risk factor is low, then the doctor might stop the medication. However, if the patient have a higher risk or moderate risk, for example, he or she have underlying medical illnesses, then the doctor might consider to continue the medicine in order to prevent major illnesses.
Doctor, does it mean that I need to be on medication for cholesterol?
A high cholesterol level doesn't mean that you must be started on medication, because doctor will assess the risk factor and categorize it based on the risk assessment. So for example, if you fall into the low risk category, then the first advice will be lifestyle modification, such as dietary control, exercise, quit smoking, and also reduce alcohol consumption. However, if you do fall into moderate or high risk group, then doctor must start you on medication in order to prevent the complication such as cardiovascular problem like heart diseases.
For more health tips and information,
Please subscribe. CLEADOC.